I'm just going to begin by recognizing that we are here from all across Ontario, and we're meeting on Aboriginal land that has been inhabited by Indigenous people since the beginning. And as settlers, we're grateful for the opportunity to meet here, and we thank all of the generations of people who have taken care of this land for thousands of years. We recognize their historic connection to the place. We also recognize the contributions of the Métis, Inuit, and other Indigenous peoples in both shaping and strengthening our communities and our province and country. As settlers, the recognition of the contributions and importance of Indigenous peoples must also be clearly and overtly connected to our collective commitment to make the promise and the challenge of truth and reconciliation real in our communities. So thank you for joining me in land recognition to start the meeting. I just wanted to review for you why we called this emergency summit. We held one in the fall, and out of that, we agreed that we would hold a second summit. But unbeknownst to us, things would actually get much, much worse between when was that? November, when we held the meeting, and this meeting. At this point, it's impossible to overstate the extent to which the Ford government is trying to move forward privatization of our healthcare. It's like a snowball that, has become a giant boulder of snow and is rolling along and just collecting more and more snow, getting bigger and bigger, and wiping out things on its path. What we're looking at now is a plan to privatize hospitals. On February the 1st, the health minister actually announced in a press conference. It was missed by the entire media corps, but what she said was that she was going to make sure that the Ford government, allows independent health facilities, which is a euphemism for private clinics, to run private hospitals in Ontario. That's private for-profit hospitals. It's a bombshell. Since 1973, private for-profit hospitals have been banned in Ontario. Since the inception of OHIP, private for-profit hospitals have been banned. This would be the first government that actually brings in for-profit, absolutely without question, US-style hospitals into Ontario in our health system. And it would be a terrible, it would be devastating to our public hospital system and our public healthcare system. So they have announced now private hospitals. They have passed under cover of the pandemic, a bill to privatize the last remaining public parts of home care. They're midstream in privatizing 18,000 of about 33,000 new and rebuilt long-term care beds. They have privatized COVID testing, contracting for-profit clinics to do it, and allowing them to charge patients up to $400 per test. They have privatized vaccinations, and the plan is to move forward with privatization of a whole range of other services, restructuring that Nancy talked about, and privatization of those services. Post-election, there's a plan in order to meet their fiscal targets set out in the budget, their budgetary targets. The Financial Accountability Office of Ontario, which is a body, it's like the Auditor General, it reports to the legislature, warns that there would have to be $18 billion, $17.8 billion in permanent cuts to public services. So it's the old adage, create a crisis and privatize. So, underfund the public system, refuse to provide the funding that's necessary to meet population need, and then hand it over to for-profit companies and even allow them to charge patients extra for services that are medically necessary. And so it is urgent. It's impossible to really overstate the urgency. I see we now have 366 people here. We're expecting just over 500 tonight. And the goal of tonight will be just to kind of lay out the facts, what's happening, what the alternatives are, and then organize a response that is impossible to ignore, so that we're 4 months away. What are we, 4 months, 5 months? June, May, April, March, February, 4 months away from a provincial election. There is no question, if we can create the the fight around privatization of healthcare in this province, we can win it. But if we don't create that fight, it will happen by default because it's all being snuck in behind the scenes. So that's why we're here today. And thank you, just a heartfelt thank you for joining us.